In terms of variants, there are three primary variants circulating in the United States right now, including BQ1.1, BQ1, and XB1.5. XBB 1.5 accounts for 28% of cases and is rapidly rising. That's XBB 1.5. The CDC monitors variant proportions and estimates across the country, which anyone can access on their website. And in this data, you'll see that the Omicron variant has now 17 different lineages. These are often the grandchildren of Omicron that we dealt with so significantly about a year ago. And again, these developments and variants are not unexpected. As viruses evolve, they often become more infectious and less severe in the disease they cause. These newer variants can evade some previous immunity, and they tend to bind to human cells more tightly. However, higher levels of neutralizing antibody from recent COVID infection or vaccine continue to protect individuals from the more severe symptoms. As a reminder and for comparison, this time last year when we were first starting to see the spread of Omicron, we were caring for about 760 patients in our healthcare system. And if you remember, hospitals across the country were struggling to find room for patients. That's not the case currently. And then finally, influenza and RSV. Seasonal influenza activity has still been high, but we've seen a decrease across our system lately. Same thing with RSV. The numbers are down significantly, which is great. The CDC estimates that we've had about 14,000 deaths from flu so far this season, 74 of which have been pediatric flu deaths. And as a reminder, the best protection against influenza and serious outcomes is that flu vaccination that's out there. And like I mentioned, the RSV cases are down, which is great. There have been less hospital admissions due to the virus at our Novant Health Himby Children's Hospital in Charlotte. I will say I wouldn't be surprised if we see another increase in flu cases, another little hill or peak over the next couple of months, since the first wave of flu came really in October. That's pretty early for the flu season. So we may see some more later, but hopefully the worst of flu and RSV is behind us for the season. So